This is Dr. Farah. Today I will talk about euthyroid nodule as to how to correctly manage a patient coming with euthyroid nodule as per new recommendations and guidelines of 2017-18. Now, when a patient comes having a nodule in the thyroid, next step is thyroid profile. You have to look at TSH. If normal, it's labeled euthyroid nodule. Next step is ultrasound guided FNAC biopsy. This is how it looks like. This is the needle, FNAC needle, and this is the ultrasound probe. Now, according to the Bethesda grading system, the FNAC biopsy is divided into 6 grades. Grade 1 is a non-diagnostic nodule in which the tissue wasn't sufficient enough to determine or conclude the correct diagnosis of the nodule. So in this case, you have to repeat the biopsy. Now, second grade is benign. When the biopsy report shows a benign nodule, then it can be adenoma or thyroiditis. Further, you have to rule this out. And then if it's an adenoma less than like 2 inches, then definitely you have to do a follow-up after 6 months in order to rule out the ultrasound characteristics of the adenoma. If compression symptoms develop like dyspnea or apnea, then definitely you have to repeat the biopsy, FNAC biopsy. Now comes the 6th grade. This is a malignancy. If the thyroid nodule, FNAC biopsy of the thyroid nodule shows malignancy, then definitely the option left is total thyroidectomy. But for each and every cancer, the step-by-step guidelines or treatment guidelines are different according to the cancer, thyroid cancer. Now comes the most difficult nodule to treat, indeterminate nodule. Okay, when you do an FNAC biopsy, you have to reserve some thyroid tissue in order to get the genetic markers. Molecular genetic testing is a very burning topic. It's very much debated about, and this genetic expression markers can determine whether that nodule is benign or suspicious. Now, coming to the indeterminate nodule, if it's atypia of undetermined significance, there's a cancer risk of this much %. If it's a follicular neoplasm, it's very dangerous because of capsular invasion. It can spread hematogenously, which is in the blood, and if it shows suspicion of malignancy, the cancer risk is very much high. So in all 3 of these grading system, what you have to do, definitely lobectomy is done. You have to take a frozen section of the tissue in order to get a histopathology report, because histopathology report will give you accurate diagnosis. Then accordingly you will treat the patient. Now, talking about the molecular markers, the ones which are very validated is Afirma and Thyro-Seq2. Now, this is a very important test, and it can clearly guide you whether the patient has a benign indeterminate nodule or if it's suspicious. If suspicious, then definitely surgery, and if benign, then observe. So this is a brief summarization as to how to approach a patient with euthyroid nodule. If you have any questions, you can tweet me or you can contact me at meddixon@gmail.com. Thank you.